All right, good morning, everyone. Welcome to the July Board of Health meeting. I'd like to call this meeting to order. We have the agenda in front of us. Does anyone have any updates or recommendations for the agenda? Looking at this, I would like to move the executive session at the end.
That's fine.
After when the agency activity report, so we'll have time to go into the policy discussion and the executive session at the end.
Yes, sir.
Any other thoughts?
That makes sense.
All right, then we will do that. I'd like to get a motion to approve the June meeting minutes.
A motion to approve the June meeting minutes.
Second.
All right, all in favor, say aye.
Aye.
Aye. All right, anybody online for public comment? No, nobody online, nobody in the room. We will move into Amber's report.
Good morning.
Amber.
All right. So starting with May, we currently have a bank balance of 193,000. We're going to take off our reserve amount of 411. So we are out of compliance by just under 218,000. May's revenue brought in 46,000. Salaries were just under 107,000 and operating expenses 14, which gives us a deficit of 74,000. Fiscal year to the end of May, we have a total revenue of 1.2 million, which is down 12% from budget. Salaries 1.1 million at 1% above budget, and operating expenses at 323,000, which is 10% above budget, for a deficit of 280,000. Accounts receivable 169,000, 49% of which is the West Virginia Treasury. Any questions for May?
None for me. I'm assuming that all the revenue for the fees are in June, so we'll look at June. Is everyone okay moving to June and then?
Yeah.
All right, let's go ahead and move into June.
All righty. So June, we're done with our fiscal year. So we have a bank balance of 349,000. We're going to take out the reserve amount of 420,000. So we are out of compliance by 70,000. June saw revenue of 355,000, salaries of just under 94,000, and operating expenses of 24,000, which puts us in a surplus of 236,000 for June. The full fiscal year ended at 1.5 million in revenue, which is actually up 1% from budget. 1.2 million in salaries, which is where we expect it to be, and operating expenses of 347,000, which is up 8%, for a deficit of just under 44,000. Now, I did want to point out, we were looking through the financials, Charlie and I, and we realized we started writing off that really old debt, and 44,000 in write-offs. So if it wasn't for the write-offs or what write-offs we had, we would have broke even, basically. All right, accounts payable for the end of June, 242,000, 35% of which is West Virginia Treasury. So any questions in June?
I will say our operating expenses were, when I calculated for this fiscal year, did not expect the inflation that we had on certain things. So that's why we went a little bit above budget on that one, which I calculated into this next coming fiscal year. So I think, again, and as Amber said, we did write off. We hit a huge chunk of that.
Yeah, I see we don't get it all, but
We haven't got it all yet. It's a lot. It's a lot of
a
small.
lot of $3 write-offs.
Yes, Yes,
That's quite the chore.
yes, and poor Wendy, Jenna, and Krista even have been working at this stuff, and Alexis has went into the environmental side of the house doing it too, and it's been a lot.
We're
A lot.
cleaning up.
Yes.
This is
Yeah.
a multi-year,
Yeah.
this needed to happen.
Oh, yeah. I mean, you gotta think some of these are not just 360 to, a month, a year and a half. These are like 4, 5.
2019.
Yeah,
Yeah.
pre-COVID even in a lot of cases. So it's definitely a lot of going in, and they've done a fantastic job so far. And but yes, as Amber said, looking at it, it was this slight issue with the operating expenses, the inflation of certain things that we did not see coming. And then additionally, the write-offs.
Is there more to be written off?
There's still a little bit more, not a whole lot. I think,
40,000.
about 40,000. But again, that's in the minutia of 3, 5, 10, 25, $50 at a time, which is, it's,
We're taking away at it.
we are.
Yeah, keep it a priority, and
Absolutely.
then once it gets cleaned up, it might take another 2 or 3 months, and it's probably better that gets allocated across 3 months versus just taking it all in July. But then it's maintaining it going forward.
Absolutely. I think MMSWV has done a great job too, keeping us above board on this stuff as well, so.
What's the status of the accounts receivable? And I guess up to 180 days.
So all those, up to 180 days, all those are through MMSWV.
Okay,
So those are things that may have been
Okay.
not received yet, or they've changed the PCT code and
okay.
rebilling.
So the category that's 181 to 360 days, the 10,031.
We may end up having to write that
Some
portion
now,
off.
yeah.
We're trying not to, but
Okay.
we're with the guidance of MMSWV is what we can and can't do.
Okay, that's good to know. That's still a pretty big hit.
Yeah, it is. It is, unfortunately. It's as we talked about, it's gonna hurt when it's all written off, and it's gonna look. But it's like I said, stuff that we've been carrying on for so long that has really thrown our financials off.
Yep.
For the last however many years, I think over 360, but
Yeah, you can't keep carrying that.
no.
And the 107,000 up there in current, I'm assuming that's the environmental health fees that are left over.
Yes,
That
Yeah, we're
includes-
expecting to continue to take payments until August 1st. So we still have, I think we're more than halfway through, so about half left, yeah.
Okay. All right. I mean, at some point, it'd be maybe nice to see on other receivables, what's clinical and what's environmental.
Yeah.
I know that's a little bit of work, but, so that's a culmination of both. And then the receivables on the left side, that's all state funding and grant funding on the left. Yep. Okay. All right, any other questions or comments on the May or June financial record? We need a motion to approve the May finances.
A motion to approve the May finances.
Right, all in favor?
Aye.
Aye. Ayes have it. Thank you very much, Amber. We appreciate your help this morning.
Of course, y'all have a good one.
Bye, Amber.
Hi, Amber.
All right, let's check. All right, discussion on moving Board of Health meeting dates to second Thursday of every month.
yes.
Wanna, I'll paint a picture, go ahead.
Yeah, so with the new health officer, she is here at fully on Thursdays all day. She does carry her primary job, which is Monday through Wednesday and Fridays. In order for her to be present at these meetings, it would have to move it to a second Thursday of every month. That's if the board sees fit to do that. I do have notes and stuff from her for this meeting. So those are obviously, it's a doable aspect if we keep it on Fridays, but to have her present, it would need to be moved to at least the second Thursday to keep it in the same week and same kind of flow schedule.
Makes sense.
Yeah, it does for me too, but I was thinking about something and, but just throwing it out for the group.
Absolutely.
Cause one of the things, like with the second Thursday or second Friday even, the month financial records aren't complete. So we're always kind of spanning 2 months at a time, like a final and a preliminary and kind of versus kind of every month seeing the final. And if we were to move it to the third Thursday, could Amber guarantee, and I know she's already hopped off the call, but that the financial could, we could have the finances just for the 1 month that we're looking at, and that's just an idea. It's the third Thursday not work?
Yeah, county commission meets on the first and third Thursdays.
Okay.
Usually,
Yeah,
they've had a bouncing schedule this year because of holidays and some other things that have happened. So, but Thursdays were really dangerous for a county commission, so.
okay, then I think that being said.
There's another famous board you may have heard of called the Eastern Panhandle Conservation District. That always complains about the commissioners not attending. Do you know when they have their meetings? Directly opposite the county commission.
Third Thursday.
Yeah.
Are Thursdays always bad, Jack?
Yeah.
Okay, because I was wondering, to Brandon's point, if maybe we could consider the fourth Thursday.
Well, the second and the fourth should be okay. Or the second should be okay.
Okay,
But a lot of holidays fall on the first week.
Yeah.
And that might be that they might push it that month and make it the second and fourth, so. I have no control over the calendar, but if it's a county commission meeting or this meeting, I'm afraid I'll have to go to a county commission meeting.
Yeah,
I
understood.
hope you can, you might be able to handle it, but you never know.
all right.
I mean, there is the option to keep it the same.
Mhm.
And having Leah provide report information. I'm not a fan of that personally,
No,
because I feel like the health officer needs to be involved. But again, finding the right fit is.
Yeah. Well, it seems like second's better than third, clearly. And then is the fourth better than the second? So if the county does shuffle, well, I guess if they shuffled, it would be 2 and 4.
Yeah, I never know what they're gonna do. I don't control the agenda.
Yeah.
Or the meeting dates. But
Mhm.
the fourth would actually be safer.
Okay,
Yeah, safer, but
not guaranteed.
I wouldn't worry about it too much, so kind of
well, I think we want to have it. I think it's better with, with Leah's here. It's better,
Absolutely.
Jack, if you're here.
the reason that the fourth might be better,
Yeah.
if you're gonna make a change, you should have your financial records.
Yeah.
Absolutely.
The way that the county commission works is usually the first meeting of the month that we have is the morning. Starts at like 9:30. The second starts at 6
At night?
at night.
Okay.
So the second Thursday would be a lot safer, probably 99% proof. If you want to go that way, and it sounds like it's an advantage on the financial stuff, to have it later. Does that work with Laura?
Yes.
She's congenial, that's why I like her.
We're all
I mean, Thursdays in general. I feel better for me. But that's
All right.
irrelevant.
And that is also,
Fair.
that's also the other aspect too. You all are, this isn't a full-time gig for you all. You all have jobs and lives and stuff like that. So if the Thursday doesn't work as well, or your work schedule, your lives, that also factors into it as well.
Thursday's a little harder for me. But I'll just have to make it work because I want to have it where Jack's here, Leia's here. It might pose an occasional conflict, but I'll just have to work around it. And so,
Yeah, let Eddie Benitez know as soon as possible that it's the 4th. And the reason I say that is we have 2 openings
Yes,
and we want to make sure that the people who apply can attend the meetings. That's one
Yeah,
of the
great
questions.
point.
One of the things I'm big on is coming in for an interview in person. The second thing is, can you attend all the meetings? And if you're fuzzy on either of those two, you probably won't get my vote.
fair,
So,
yes.
Got it. Yeah, great point.
Yeah.
Well, and also just for overall awareness and participation and openness and
yeah, I hate pointing people to these boards that then never show up.
Yeah,
And we've had Parks and Rec has had that problem, at least one member over the past 4 years, 1 meeting in 4 years. So that person did resign and is to be replaced, but Jennifer Myers, who's Parks and Rec, does not like to drop the axe on anybody. She's even more congenial than Bob. So she doesn't like to play the rough game. So we had to kind of force Parks and Rec to take the step and replace. But I presume people applying to this board would be dedicated professionals.
yeah.
But that's what I've seen so far.
We've not had a problem. Well, I don't know historically, but this board's been pretty good about showing up.
Yeah, I think so.
At least it's out there.
Just make sure that Eddie knows.
Yeah.
So when she puts out the announcement that the people that apply
Okay.
understand.
Absolutely.
Thank you.
So do we want to move it to the 4th Thursday?
We move it to the
Yeah.
4th Thursday of every month.
Second,
Great.
is that a motion?
Yeah,
Yeah.
I can motion. I
You can
make
make
a
a
motion. Sorry.
I think you have
All
that.
right.
Yeah.
Favor say aye.
In Congress, the chair does not typically make motions. But in a board like this, on where you are actually the parliamentarian, you can make a motion.
All right.
Okay.
Correct.
Then I so moved.
Don't be bashful.
All right, we got a plan. And then I guess just kind of moving forward, our next scheduled meeting would be August, the last. That's a pretty long time, but I mean, we meet monthly. I think the statute is 6 times a year.
Yeah, I think you can do
Well,
it the other
within-
month is within the statute,
So,
so.
is everyone okay just punting to the last 4th week of August?
Mhm.
Okay.
And we would still meet 12 times. It
Yeah.
wouldn't change the amount of time, even if we moved it.
August is the week after the Jefferson County Fair,
Oh,
right?
It would be left.
So that would be good because there's always injuries at the Jefferson County Fairs, from bee stings to heat stroke to whatever, so.
Okay. I haven't seen any accident incidents yet.
All right, we're gonna move toward the fiscal year 27 program plan.
So attached was the updated copy of the program plan. We did take out the OBMAC portion. Obviously, some things were updated with Leah as the health officer. So ultimately, all in all, the program plan, which is kind of like our, again, Dr. Reedy had always mentioned, like, it's kind of our driving force in what we do. It pretty much stays the same. And that falls into a little bit from the health officer side, where we're not really stopping any programs. We're still continuing the programs. We may not be advertising a few things, but we'll still be doing them. The only thing that we really are stopping is OBMAT. And that was one portion that was taken out of the program.
Okay. And this is the continuation of what you guys developed last year.
Correct.
And was last year, the first year we had a formal,
I don't know if last year was the first year that they had a formal.
Not the first year ever. It used to be required, but the first year since, I believe, 2020.
I was about to say.
So there was about a 5-year.
So part of that reason came from the audit, that we did not have one,
so this was an audit finding from the
Yes.
state.
from the state,
Got it.
2 years ago, I guess it would be now.
And not just a program plan, but a program plan evaluation.
Yeah, they want to, well, they make sure that we have a program plan that was evaluated and approved by the board. I don't think they really go in depth into looking at the program plan itself. They just want to make sure that the program plan has been, they trust obviously the board that knows the health department. And so we did not have one prior to me coming on a year and a half ago-ish. When they did the audit, they did not have one that was approved by the board.
On page 1, the cover letter, it says budget FY 2025. I'm just thinking that should be 2027.
Oh, yep. Gotten one. I'll make that investment. I apologize.
No problem. I mean, does the board want to take this, and we don't have to have this signed off by any time. I'd like to just have all the members of the board take that as a takeaway and just,
Absolutely.
is there anything else that?
Hey, double check my stuff, please.
All right, and then anything that's kind of underlined like that is changes from last year?
Anything that is underlined is typically, kind of was added in from the previous year, and then there might have been one or two little wording changes to it that shows that we were in making those adjustments.
No, this is good. Yeah, I just wanted to,
And I can send out a digital copy to everybody as well, so you're not having to
Yeah.
rifle through papers.
let's do that, and then we'll
Yeah, I'll send out a digital copy today after the Board of Health
be
meeting.
happy to sign it next month. when we meet.
No problem. Absolutely.
All right. Discussion to increase clinical services fee schedule.
Yes, so this is something that, one of the areas when we've been looking at making changes, especially fees and services, is to. And I didn't want to bring this up without discussing this with everybody first. I didn't want to make these changes, and I want to discuss it with the board first to make sure it's a feasible thing. Is to look at the fees for services that we can make adjustment to, and taking into consideration, like Berkeley Morgan and other areas within the surrounding, what their fee schedules are, and then also adding in a sliding scale fee for those who may not have insurance. We have a few times where folks can't pay the basic fee service, so including a sliding scale fee with that as well. We had, I think, in calendar year 2025, looking at the clinical services fees, we had a post grants, we had a deficit of just shy of $100,000 on the clinical side. And trying to make sure that we kind of close that gap. It's not going to completely close it, but just narrow it some, that we can make sure that we can continue maintaining a revenue stream of sorts to, while I'm trying my best to make sure we come out with a flat budget, help that out, especially with certain increases in cost of living or fee increases on supplies.
So you're just asking for
Approval
a
to
green
start,
light to start
Yes.
assessing that?
correct,
Assess that. Yeah, definitely. I mean, we have to, it doesn't mean that we'll make a change.
correct, does not
But
mean,
we need to see what the assessment is.
Yeah.
Just like we did with environmental health, we spent months.
Yeah.
Assessing that and ensuring that our cost and revenue aligned.
correct.
We need to do the same thing for clinical.
Yeah.
Which is a lot harder task because of CPT codes and all that stuff. It will not be as cut and dry.
No, it will not be. I'm kind of started kind of looking at it too, and there's a lot of stuff that we cannot touch, and then the following under like what Medicare, Medicaid has authorized and maximum allotment, because you can't charge payment that is over the Medicaid, Medicare price, and all these things. So it's going to take, a lot of work. Like I said, also utilizing the resources that we have available from other counties of what they do as well, to help kind of guide us into that pathway. But I also didn't want to start anything without, and it'd be a surprise type of deal with it as well, bringing it to the table. Hey, look, here's new clinical services.
Yeah, and this is gonna be something that Lee digs into kind of
Yes,
in her tenure here very early on, is kind of inviting the ship, so to speak, on the clinical side.
yes. Myself and Leah sat down yesterday and had a discussion about this as well. That these are especially sliding scale fee aspects of it. Because if we do decide to move away from Title 10, we still need to make sure that we have some sort of revenue stream or a ability when it comes to family planning under Title 10, because it's all covered. And if we do decide to move away, we need to have some sort of sliding scale fee based on income and insurance rates. Or,
And what is your qualifications for the sliding fee schedule? Do you have anything?
so then that's something else I want to look at. It's going to be based off of annual income. And so looking at what other places do based on what the federal says, that they have anything at the federal level to base our sliding scale fees off of.
Yeah, just having something objective to,
Absolutely.
to measure against that's fair and
Correct.
equitable across the board.
Correct.
All right. So yeah, we'll look forward to seeing more as that comes to light.
Understood.
All right, any other thoughts on that?
Makes sense.
No. All right, moving on to the agency activity report. We'll start with environmental.
Alrighty, so this will be my last board meeting with you guys for a little while. I have some plans coming up, so.
What's going on?
I have a good maternity leave timeline, an idea of one, if it cooperates. That will begin next month, and I will be out for about 12 weeks, total. Brandon and I are working to just make sure that everything's gonna continue to go smooth while I'm out. And then I will return in mid to late November, I believe is the current plan. And so I will have 2 months of the end of the calendar year to make sure that everything just is on the up and up, and hopefully we'll be able to end the calendar year with my targets in mind. As a part of our audit improvement plan, I did develop a schedule and a target amount of inspections that I want to reach before the end of the calendar year. So currently, and I've set deadlines throughout the year to assess progress. So for our high risk facility inspections, I have 3 deadlines in mind because there's 3 inspections per year. We just passed the first deadline, April 30th. We have a total of 67 inspections that needed to be completed. We completed 31, which puts us at 46.27%. My target is 70%. So and again, I built this kind of after the fact. So our first deadline was not great, but compared to last year, we had 70 facilities and we did 22. So we were actually at 31%. So we've jumped up about 15% since last year in that category. For our medium risk inspections, which is the bulk of what we're doing, that deadline for the first round to be completed was June 30th. So out of 182, we completed 135, which put us at just about 75%. So we were 5% above my target. Again, 70% is passing the audit. So my goal is let's at least pass, and then we can only improve upon that, right? So
Say passing the audit, the state,
the
the
state,
state has a 70%?
yes.
Okay, got it.
So as long as we complete 70% of our targeted inspections, they will mark us compliant in that category. Which food was the one of the two that I was deficient in. It was food and childcare. Now, for childcare, that is the one we really picked up on. We had 36 child cares that needed to be inspected by June 30th, and we got 35. Just missed one, puts us at 97%. And we picked up that last one right after the June 30th deadline. So I think we'll be able to squeeze it in December to do it. Maybe we can get 100% in our childcare. So we will definitely be compliant in that category. Our food establishments are, it is what it is. It's just a labor and, time.
Well, having the staff would be very helpful
Yeah.
for that. You have 2 positions open.
Correct.
Yes. As far as hiring is going, I have not reached out to candidates yet. We have not started interviews. At this point, I don't know that we will unless you plan on doing them while I'm out. So I'll leave that to Brandon.
Next week, the other thing. Straight.
Okay. I'll leave that for his update. The Board of Sanitarians met in June to discuss the training platform. So that way we can start to have an idea of what it would look like when we do hire. And I was very pleased with the outcome. They have signed a contract to partner with West Virginia University School of Public Health. And the School of Public Health is going to develop an online training that will be available all year round. So there will not be any in-person travel requirements. It should not take the length of time that it took. And then as soon as we hire someone, they would then be able to start the online program. And the goal is that they would be able to complete that program and have their assessment, their, with the state, on the job training and obtain their licensure fully within 6 months of their date of hire. So that is much accelerated compared to what we were having before. So I was very pleased with that. They said that it should be ready for new hires to begin enrolling this year. Most likely in the fall, probably a couple months for WVU to transfer everything and create the platform. But it should be ready this year, is what they said.
And for that reason, wait for that to kind of
Yeah.
end your maternity leave, but kind of wait and let that kind of bake a little bit before bringing somebody on.
Yep.
Okay.
Which leaves us with 2 sanitarians working in the department, 2 office assistants. So we have split it up so that 1 sanitarian is going to do our well and septic program. 1 sanitarian is going to handle all of our facilities. So I imagine that the number of inspections that he is able to accomplish will probably drop. His target is at least 20 a month, but that does include his opening inspections that he's doing for new facilities. So, we're probably gonna see right now, I think we're averaging about 50 between him and I. So that'll drop about half for August through November until I return. So this will probably be the best numbers we see until I come back. But they're doing their best and I'm very proud of them. So I do want to say that they worked really hard. As far as how June went, I do have updated numbers. We did do 46 inspections in food, and then we had 13 general sanitation inspections. We had 8 new facility applications and we opened 9 new facilities. Our well and septic information requests are almost more than double what our monthly average is. We're seeing just a huge uptick in I don't know if it's just a very busy real estate season, in Jefferson County, but there is definitely a lot of home sales going on, and with every home sale generally on a well and septic property, they're requesting those records as part of it. So I just think it's part of the busy summer season that we're seeing that uptick. So I anticipate that that will start to drop off as kids go back to school and all of that. All of the real estate calms down. The rest of our well and septic program, we are pretty much above average in every category. We're doing 27 visits a month, issuing about 28 permits a month, and we are receiving just about 40 applications a month. So, we do only have one sanitarian working on these, so things are surprisingly not falling behind, but they're right on that cusp. So I have been getting a lot of questions from the public asking for updates on their permit, and currently I just tell people we do everything in the order that we receive it, starting from oldest first to newest, and we are going, you know, as efficiently as we can under the current situation. So renewals, same thing. We are going in the order that we receive them. We have received more than half of our facility renewal packets. The permits need to be individually created, which is a little bit frustrating, but I have an idea on how we can fix that for next year. This year, though, it's a little bit delayed. So I've been telling people, again, we do them in the order that we receive the payments, and we're just putting the permits as fast as we can, to get them out to people. For the public, I have contacted the local municipalities, and we have confirmed that if the public needs the health department permit for business license purposes to obtain another type of licensure, that they will accept the health department receipt until our permit gets issued to them. So hopefully that's going to mitigate a little bit of the demand. But other than that, that's everything. We've been very busy.
Sounds like a great tool you created to objectively measure what you're able to do, and I know it's hard without the staff.
It is. It's just bad timing all around because of the maternity leave and, you know, the training, and so it's just gonna be a rough end of this calendar year. But I'm definitely hopeful that even with just 3 of us, that we've been able to improve on last year's numbers, that when I come back and I'm fully mobile again and a human being again, that we're really gonna be in a good place, I think, with the staff that we have. So I'm excited. Just gotta get through this next few months.
Challenge at a time.
Yeah, exactly.
Best of luck to you and the new baby. We'll see you in November.
Mhm.
Clinical activity?
Clinical, I'm going to kind of combine clinical with the kind of the health officer aspect, if that's okay. Sure. So our numbers are for June were down just a little bit in the family planning. We saw 15 encounters. The monthly had just 17. No breast and cervical cancer screenings. They had an increase though in patient encounters for STI. From 13 to 21, that's a little bit above the average at 19. Vaccines, obviously not a huge time of year for the vaccine, so they did 58 total, 31 with childhood, 10 flu, 7 COVID, and just all of around vaccines, mainly it's travel, is 10. They'd had 5 TB skin tests and 4 others, which would be kind of their checks and stuff like that. And animal wipe encounters down just a little bit from 18, which I'm pretty sure Jenna was happy about, because those can be wild. So with the clinical side of the house, and the new health officer taking over, we sat down and discussed, and, we're going to continue running the ship as we go along, right? So we have certain things that are mandated, by the state. So environmental is one of them. STI testing is another, animal bites, TB, falls under the communicable diseases. So we are mandated by the state to do those. So we're continuing to do the STI testing, continuing to do the BCCP program. Obviously continuing to do the immunization program, which is also mandated by the state. Continuing to do the HIV prep. However, we're still going to do Hep C. This is where the big change is in this. We're still going to do Hep C, but we're not advertising. Like we did with Dr. Reedy, who was present every day and available to see those patients every day, the hour plus long exam that need to be done. If a patient is referred to us, if a patient is tested positive previously and comes to us, we will see them. Obviously, they will have to be on a Thursday, but Leah is present. But we're just not really advertising like we had. And really kind of, hey, look, other facilities in the area, Shenandoah, WMS, they'll know that we'll still do this, so if they have somebody, they can send them over to us. We just are not actively seeking those individuals. That's really where the big change is. And of course, no longer doing OBMAP. There was not a huge draw for those numbers, unfortunately. I think they saw 5 patients last year, so. And then caveating into the health officer realm, I do want to bring up the cyclosporia situation that's going on nationally. West Virginia has declared a statewide outbreak. However, we do not have the numbers on how many. They say they average about 9 a year annually, these cases. So some of the symptoms that population needs to be aware of is obviously diarrhea, cramping, fatigue, low-grade fevers, and also bloating and gas, which, I mean, could be numerous other things as well. Depends on what you ate for dinner the night before, you know. But onset usually takes about a week to 2 weeks post eating the contaminated food, which is mainly a lot of vegetables and fruits that haven't been washed right and cleaned up. So the duration lasts anywhere from 2 days to 2 weeks, that could last up to a month. And so one of the big things is wash your fruits and vegetables thoroughly. Regardless of if you feel like, oh, I got it from pre-bagged, those are salads. Those are actually some of the worst ones that are getting it right now, where the contamination is coming from. So wash them thoroughly. Additionally, wash your hands with soap and water frequently. This way, if you do happen to mess with contaminated food, and you can wash it off, it's still going to, like, hands or whatever, just make sure that you don't spread that also to other people. Is a big one. So I want to throw that one out there, since that is kind of the big thing going on right now. Our health officer update aspect of stuff.
Question,
Yes.
how do we communicate that to the community?
So Facebook, I don't think we have an Instagram, but Facebook
Facebook.
post or website now that it's up today. So
I posted the CDC flyer.
Yep.
Okay.
On Facebook.
Okay.
and we can always put that also additionally on the website, making sure that when people see it, hey, oh, this is something to make sure
Yeah.
I'm aware of.
Yeah, think of it as a campaign and not just a
Absolutely.
post.
No,
You know,
absolutely.
Maybe 3 separate posts over a 3 or a month long period, different images, different text, but just keeping it front and center.
Absolutely. This is definitely something that it doesn't just go away, right? This is an ongoing thing. Like I said, we annually get as a state about 9 cases a year of it anyway. Obviously, a lot worse this year than before. So making sure that people are aware that things that we do that may be taken for granted, like I said, washing fruits and vegetables, right? make sure that we just follow along with that. And of course, hand washing is always a big thing, regardless of what time of year it is and what's going on. Always wash your hands. And the fact that we have to say so with soap and water is fun too. Yeah.
All right, anything else?
Uh,
Health officer.
from the health officer, no.
Okay.
On to mine. Nothing really to put out, but mainly for department aspect of it, as far as day-to-day operations kind of, but much like my colleague, I will be out of the office for a while, starting July. I have surgery on my back July 24th. Unfortunate aspect of my previous career. I sustained some injuries that have grown and gotten worse as time has gone on to my back. That means that it will take me out of commission for a while. However, what that does mean, while I will be not in-house operating, I will still be able to do operations from my house. So things like the agenda, things, Board of Health meetings, all these things, everything will still be ran operationally. It's just I will not be present in here for about 10 weeks due to the nature of the surgery and what they're doing. They tend not to want people to drive and travel like that. So that being said, we are putting plans in place to make sure every day-to-day operation is functional. Everything is going to be maintained. There will be no miss. And trust me, everybody, if I forget something, somebody reminds me of something to think about as well. Because, and that's how it should be. If we will make sure everything is operational, I can still be present for the meetings. I will be virtual for it. Will not be on camera if that's okay. I don't think anybody will want to see that due to the fact of the pain medication that's involved with it as well. So I want to give that update to the board. It's was not planned that I would ever have this surgery. And unfortunate situations that have happened have caused me to have to get this taken care of, not just for the well-being here, staff, but myself and my family. So definitely a hard conversation to have with the staff and bring up, and it's because I don't want to feel like them to feel like I'm not want to be available. I will always be available to them, and they always know that they can always text me anyway, even if it's at midnight. I may not answer, but you know. So and they worked so hard to get to where we are now that I don't want them to feel like I'm not present for them. So, but unfortunately, like I said, it needed to be done.
It doesn't sound like it was optional.
No. When the words out of the doctor's mouth are, "How are you functioning?" When they look at the MRI, you know it's that time. So, yeah. Okay.
What's your surgery?
July 20th. The week of, I will be doing a lot of pre-op appointments due to a family history of an issue, malignant hypothermia. That at the military medicine, they take that a little seriously. So I get to have EKGs and all that stuff as well. Good time. I know, good times, right? Anybody else want to have go for me? I would gladly swap that out. As somebody that's had multiple surgeries, a lot, this was the last thing I ever wanted to do. So, especially on my back. But yeah,
Best of luck to you in that surgery.
thank you.
Sounds like a serious one.
It's not going to be it's not an easy one, that's for sure. Thankfully, they're not doing a fusion. It's just I don't know if it's going to be much better than the other recovery. but we'll see. See. Thank you.
Any others?
No, like I said, we're putting in place, plans for day-to-day operation, making sure that everything does run as smoothly as possible. Things that I take care of daily, or weekly, like taking the labs out, and making sure we have all those in place. And still making sure that everything stays running. So I'll have a new Mac, we'll have a new baby at the office. It'll be a good time, come fall time.
Yeah.
One thing I did want, actually, that I do want to put out with the environmental health. That's part of the reason why we're pushing some of that off, but also, on a good note, they did come up with a cost of training.
Oh, yes.
So it will cost us $3,000 a,
35.
3,500? Oh, okay. So $3,500 per individual sanitarian to be trained, which is actually about $6,500 less than what it costs us to send them to training.
For hotels and gas and meals for 6 weeks.
So we can essentially send almost 3 individuals for the same price as one now to train, which is
Yeah.
very good on my budget.
And it's quicker.
And absolutely, we can have everybody up and running within 6 months instead of almost a year. So that they'll have that 6 months by the time they come in, get them situated, off to the races. Sweet.
Yeah, it's great.
So definitely looking forward to that.
All right, anything else before I move, we go into executive session for that policy discussion?
Just wanted to comment that county commission has hired 11 candidates to do EMT training. So basically what I've been told, we essentially have money for ambulances for the mountain and Bakerton, but we haven't had EMTs. So if we had ambulances, they'd be sitting there doing nothing. So this is a step to bringing back full coverage to the county. So I'm optimistic on that because that's one of the big things for the county, which I think has been a nagging problem, is coverage. Bakerton doesn't get very many calls per year. Mountain does, so we need an ambulance out there. So that's good news on the health front.
That's
Great,
Awesome.
Jack. Thank
Yeah,
you.
thank you.
Mountain definitely needs that out there after going out to that emergency.
And not to mention they need an escape road.
Yeah. There's a few things.
Maybe several escape roads, or at least a plan where you hike.
Yeah.
We could have river riders ferrying people across the river. So.
Tubes.
Thank you.
Thank you, appreciate it. Thank you, Alexis. All right, we'll move to executive session. All right, I'd like to move, we come out of executive session. I think I have to do that again on the wording, I think. Can I get a second?
Second.
All right, all in favor, say aye.
Aye.
All right, and then, can we get a motion? This concludes the agenda. I'd like to get a motion to adjourn the meeting.
Motion to adjourn today's meeting.
Second.
All in favor?
Aye.
Aye, this meeting is adjourned. Thank you.
Thanks, everyone.